The key elements of our program, there are two that I always highlight. One is our longitudinal curriculum. And so residents spend a month in orientation. And then after that, all 3 years, they rotate frequently through our experiences 1 or 2 weeks at a time. This is very different from our traditional 4-week block structure. That's something we've built here, have been doing since we've started the program, and are very proud of and think it's been a successful curriculum. The other thing that we like to highlight is that we are osteopathic recognized by the ACGME. So we welcome MDs and DOs and are working very hard to help our DO residents maintain board certification track.
The main goal of our residency program is to train and serve rural communities across the state, being able to provide full spectrum care, whether that's in the outpatient setting and providing a wide range of procedural opportunities, or the inpatient setting where we're taking care of newborns, delivering babies, adults, and geriatrics. We want to promote their abilities no matter what specialty they go into.
The way our curriculum is set up, they'll have a week rotation of whatever experience they're having at a time. So they'll spend a week inpatient, a week on pediatrics, a week on OB, a week in the clinic. That does give them a full 5 to 7 days of really dialing in on one thing, but it's going to be constantly switching it up in the sense that when you become a full scope practicing family medicine doctor, every day is going to look different. We want our graduates to go out and be able to be the doctor of that community, and not only be the doctor of that community, but be someone who is helping to encourage and inspire health.
Every year it looks a little bit different for every resident, but our first year is kind of a core curriculum that we go through. We rotate through everything because we are aiming to be full spectrum family medicine doctors. So we do obstetrics, we do pediatrics, we do adults, we do geriatrics, we do sports medicine. We rotate through everything. So first year is kind of getting your feet wet, trying out everything. Second year is diving into electives, kind of finding what you're interested in and honing in a little bit more on that. And then third year is exploring what you want to do once you finish residency.
I just got a really great feeling when I interviewed with the program. All of the faculty I interviewed with, as well as the residents I got to talk to. The program has a lot to offer as an unopposed program in a rural area. I knew that I would get a really robust education as a family medicine provider, seeing a lot of different pathology here and having a ton of learning opportunities available to me.
Oconee County is a predominantly Caucasian county. We're in rural South Carolina. Our clinic sees a wider variety of patients than what our county has, just because of the services that we provide. We have a large Hispanic population that we provide prenatal and newborn care to. Those families often become patients in our clinic. We offer refugee care to patients in our area that have come here from other countries. We partner with Clemson University with their master's and graduate students to take care of them and their families. We have a very diverse population in our clinic, more so than what you would see just from county demographics. We want our residents to be comfortable using interpretation services and community resources, and we have a social worker on site that helps us tap into resources so we can help take care of those underserved patients in our area.
The word family gets thrown around a lot when you're interviewing and when you're on the trail, but I can really say that is something that defines the Seneca Family Medicine Residency program. I feel like they care about me, they're invested in me, they love to teach, they're patient, they're kind, and they're invested in your success as an individual. Everyone's very supportive, and it's just a very friendly atmosphere.
We really get to know each other. These people become your family. You're with them all the time. The people here, that's what really makes this program. Everyone from our office staff, the nurses we work with in the hospital, you can tell everyone truly wants to be here. Everyone truly likes their job and they truly care about what they do and care about our patients. My one piece of advice to anyone looking at this program is definitely apply. We would love to interview you and talk to you, and make sure that you are truly interested in our mission to serve rural communities.